us.
Dr. Jonathan Tripp, we haven't seen him in about 3 weeks, I guess, because we alternate with a few different folks from the office when they drop by on Better Health with Tripp Family Medicine.
I bring in the smarter people when I'm not here.
Got to see you the other day, though. I was coming to work and saw the new billboard.
Oh, nice. So, I'm everywhere?
Yes.
No.
I think all of you are up there, the
Yeah.
entire.
In fact, we had all four of the practitioners from our office on the billboard, and I was the farthest to the right, and so I've had people comment, if you're the doctor, how come you're the last one on the billboard? So,
People are reading from what, left to right? Yeah,
yeah,
I get it. Okay,
exactly.
that makes sense. So totally different when people say I'm the farthest to the right. It's got an entirely different
There
meaning.
you yeah, it's got the political side.
Yeah.
Yeah.
We're talking a little bit about jaw pain today. Actually, I don't know that I could pronounce it. TMJ is the acronym, right? But
Yep.
there's a big long word for that.
Temporomandibular joint is the joint we're talking about. But when people talk about TMJ, they're usually talking about the pain that goes with that joint. And so actually, let me just define it. TMJ, people say, well, what is that? And I use a lot of my sources from what's called the National Institutes of Health. And TMJ is just really disorders of either the joint itself or pain associated around the joint. And there's actually a separate acronym, TMD, which is temporomandibular disorder or disease, depending on which author you're reading. And that really is a change in the joint itself, whether it's damage to the joint or it's not hinging correctly. But let me tell people where it is, because people may know that name and not even know what we're talking about. The joint is right where your jawbone, the mandible, connects to your face, and it's where the hinge is. So when you open your mouth, that's the joint that lets that open and shut without falling off. So it's a good thing to have, but it can get really sore, and the muscles around it can get very tight, and it's very hard to distinguish from ear pain. So people will often say, I don't know, I got this earache that's been bugging me for days or weeks.
Mm-hmm.
And the doctor looks at the ear, and the ear is fine. So that's one confusing feature. And there's other things that cause pain in that area. Even headaches are often focused right around that area. So it's a tough one to say, is that really TMJ, or is it a headache, or is it an earache, or is it a facial nerve problem? There's a nerve condition called trigeminal neuralgia, which is very painful and tough to treat. And so we're going to talk about what to do, or how to take care of this, because it's a tough one.
I've had those moments. It's not frequent, but occasionally, if you open your mouth fast or you move your jaw a particular way, you feel like a pop. And there's a brief, it's not pain, but there's a brief bit of discomfort that happens with that. But I suspect it's all related to the hinge there that we're dealing with.
Yeah, and that hinge is pretty sophisticated. It's not just a ball and socket, although that's kind of part of how it looks. If you imagine a ball and socket type of a joint, the bearing part of it, the ball part of it, doesn't just twist, but it moves forward somewhat, forward and back, and twists. So it's a pretty sophisticated joint, and it has a little disc in there that we talk about, bulging discs or damaged discs in the back or the neck. This is a very small but important cushion for that joint, that the disc can actually be displaced forward in the joint. So it's being pushed forward every time you open your mouth, and there's a cause for pain right there. So um, what most people experience, though, is they will have pain right in front of the ear that radiates sometimes towards the front of the face, and can be either made worse or it doesn't change at all by opening and closing the mouth. This can be very short term, a day or two. It can be weeks or even months. And the good news is, for most people that get this condition, it is a temporary thing, but it may last, months or a year, and then kind of mysteriously disappear. And what changed?
Sometimes, I mean, if someone's had an accident where maybe they really smacked their jaw hard when they were younger, this I'm sure can come back in an arthritic condition and haunt them later on.
That is a possibility. We were talking offline, I guess, about or off air, if I say that right,
Yeah.
about you playing football and getting guys underneath the chin with a forearm, and that can cause damage. So there are conditions, a traffic accident or a fall, or a fight or something like that, that there's an actual damage to the joint. But most of the time, there's no known damage, and it just starts hurting. And so the most frequent cause is people clenching their teeth. It's the muscles that you chew with. They're called muscles of mastication. And when you chew and bite down, and you can feel the muscle to the side of your face kind of bulge out, imagine doing that for long periods of time. You're really pushing on that joint. Well, most people do this not even aware that they do it. And if they do it during the day, usually if it's pointed out, they can work at stopping that. But a lot of people do this all night long and have no idea they're even doing it.
Right. My daughter was went through a period in life, was a teenager where she was, we called it grinding her teeth, but
Yeah, that's
uh,
exactly part of it.
and then whatever stress she was having seemed to subside, and after that she was fine. But if you do it long term, obviously you're going to have some serious trouble.
I like how you brought up whatever the stress was disappeared because I want to talk about that after we come back.
All right, more coming up with Dr. Jonathan Tripp. Better Health with Tripp Family Medicine this morning on News Radio 1310 KLIX and newsradio1310.com. Bill Colley as well answering the telephones. And if you've got a question or comment for the doctor, keep us in mind. It's 736-0300. Joining us in the studio this morning, Dr. Jonathan Tripp from Tripp Family Medicine right here in Twin Falls, Idaho on Fillmore Street. That's directly across from the big post office there on the north side of the city. We should mention your contact information as well.
Sure, that'd be great. Our telephone number is 933-4400. And, you can call, and the best part is almost always you can get seen the same day if you're sick or hurt because we got 3 practitioners there almost every day and even a part-time nurse practitioner with us. And so lots of availability, taking new patients. But we're at trippfamilymedicine.com on the web, and on Facebook, it's Tripp Family Medicine. So that's the contact info.
And we were talking just before the break about stress that people will have and how that can create a lot of issues with that joint pain, and some of the long-term issues might go away if you can find a way to reduce stress.
Yeah, let me read some of the causes according to the National Institutes of Health and Mayo Clinic. As I went through these different things, they said the hang on, let me get the causes with you. It's pain in front of the ear, but I'm blanking on what they got. There we go. Causes. It says for many people, symptoms seem to start without obvious reason. Research disputes the popular belief that a bad bite or orthodontic braces can trigger TMJ. In fact, the TMJ is more frequent in women, so studies that have been done on it, they pretty much become inconclusive as to what the real cause is. And so, for a large part, they look at this and say it's kind of a mystery that it comes and goes and what's happening. But in my experience, it's pretty obvious. Most of the people that have TMJ do so because of stress, maybe true anxiety, and often these are short-term or serious, stressors in our life, some major events, and that's when this ear pain shows up, or at least the jaw tightening. So I want to give my own personal experience. Knowing the condition and knowing kind of the signs of it, I was unaware that I was maybe not grinding my teeth, but clenching my jaw when I was asleep. And then when I would eat in the morning, my muscles, the chewing muscles, felt like they'd had a major workout. And especially if I had to eat anything chewy or crunchy, it was almost a chore just to eat. And that was the warning to me that, hey, something's bothering you. So if I could give that some thought, I often would find that what was bothering me, I had not even paid attention to. And just by identifying it, I'd stop the clenching at night. So my personal experience is it's very emotion related. In other words, if we have stress or anxiety, it shows in various manners, and this is one of them.
We have a caller with us, and caller, you're on the air with Dr. Jonathan Tripp at 846 on KLIX.
Hello, doctor. I'm a little bit off subject right now, but I have a question for you. I'm on a hydrocodone, and I am trying to get myself off of that.
Okay.
By doing that, I've been cutting down on my dosage a little at a time. And also, I was wondering if there's anything over the counter that will help relieve the symptoms of the withdrawals.
And the symptoms specifically that you're talking about, is that the nausea or shaking?
No, it would be the muscle spasms and stuff like that.
Yeah, about the best I could tell you for that is anti-inflammatories that over the counter like ibuprofen or naproxen. But no, the withdrawal is a tough part, and if you're going pretty quickly on decreasing your dose, that's when you feel the symptoms most. But the truth is I don't know what your dose is or how long you've been on it, but the withdrawal can be horrendous but quick in about a 2 to 3 day period, or do what you're doing, and that is try to taper down over several weeks. And that's the best I can tell you at this point.
Okay, thank you.
Want to thank you for the telephone call, and keep in mind telephone number here in the studio 736-0300. We're at 55 on our way into the low 80s today. Dr. Jonathan Tripp joining us in studio. Better Health with Tripp Family Medicine. We talked a little bit about how you reduce the stress and it will reduce some of the pain, but some of this is just simply going to be arthritis as you get older, right?
It sure can. There's wear and tear, like your knees or your elbows or your hips. You can have straight up arthritis. But one of the main treatments is ice. Just like you sprained your ankle, if you ice that joint, it tends to feel a lot better. It's cold, and people don't like cold, but it definitely will improve. So if you know you've got this going on, the first thing I would tell you to do is 2 or 3 times a day, spend about 5 minutes with ice right on, just in front of your ear. And it may even make your ear ache a little more while it's cold, but over several days, you'll probably see great improvement. And that's better than almost any medicine we have for anti-inflammatories. It is true for sports medicine that ice is still the best. So I would assume that'd be the same for the jaw joint. But let me tell you some of the ways that they can be treated. They talk about eating soft foods, applying ice packs, avoiding extreme jaw movements like a real wide yawn, and gum chewing is a big one. If you have trouble with that joint, get rid of the gum because you're just beating it all day long. Um,
I have
they
a dentist who told me don't chew it. That was his advice.
just don't, yeah,
Right.
don't do it. Yeah, just say no. Um, so they talk about learning techniques for relaxing and reducing stress, and yet they don't even talk about stress as being one of the causes. But obviously, uh, the treatment is to reduce stress. There's also some jaw stretching that um, some docs know more about TMJ than others. My background as an osteopathic physician, I have some great techniques to loosen up that jaw. I've had people come into the emergency room when I was working that could not open their mouth more than about a centimeter. So try to eat when you can only open your mouth less than a half inch. So, and being able to treat them right then and there just by simple stretches, not even medicine, and have their jaw open up almost to its normal full width, miracle stuff, or at least so it seems. But it's just having the techniques, having the tools to be able to do that. Now, some other things that are done, the most advanced or the most aggressive is surgery. And surgery, by all recommendations, Mayo Clinic, NIH, Cleveland Clinic, they say avoid it at all costs. It's the very, very last resort because a lot of the surgeries don't make it a whole lot better. And now you have a permanent change that you can't go backwards on. So treatments that are reversible are bite blocks. Often you can do that through a dentist. Um, we talked about the jaw stretching. Um, they recommend against orthodontic changes to things that'll actually change your bite. Uh, crowns. I doubt this is used frequently, but teeth grinding to try to make things fit better in a bite because it doesn't seem to change it, but now you've got ground down teeth. So permanent changes they really recommend against. Um, some others that can be used are steroid injections right into the joint. This is like what we do with a sore knee or shoulder. Steroids will decrease inflammation and often be the impetus to the joint healing. So that's a possibility. That's one that I would get done only by uh, a surgeon or a, an oral surgeon is what I'm trying to say, or somebody like an ear, nose, and throat doc that knows the anatomy of that jaw joint and the nerves that go by it very well because it's loaded with nerves for your whole face right in that area. So I'd make sure you get kind of an expert person to do that type of injection in the joint. Another one that has become more popular lately fits right within my cosmetic background, and that is Botox. So when you think of this is too tight a clenching of the muscles of chewing, and those muscles are right along between your jaw and your cheekbone, but also kind of above and in front of the ear is a long part of a muscle called the temporalis. And so Botox can be used to decrease their strength. Botox basically paralyzes part of the muscle. And so you decrease the strength of those, the emphasis of those, and you stop putting as much pressure on the jaw. And so that's a possibility as well. But so Botox isn't just for beauty anymore.
Some of us, we old timers, remember when Muhammad Ali was in a fight with Joe Frazier, and Frazier hit him so hard he broke Ali's jaw during the course of the fight. When we hear about that happening, though, that's generally forward in the jaw, but not necessarily in the joint, right?
Correct. It's usually the mandible itself, which is what we think of as the jawbone.
And that just requires a setting it and no movement for a while until it heals again.
Yeah, it's the diet program of wiring your jaw shut. So
Yeah.
that's I've heard people lose weight on that, but I've heard a lot that found a way to actually gain weight when they can't open their mouth. So if you live on milkshakes, you're still going to gain weight. But that is correct. Almost all of the fractures are below the joint, but it's still with that kind of a hit could cause damage to the cartilage and the surface of the joint.
Some people, though, have actually, I'm sure, fractured the joint, and that's a
Absolutely.
serious medical issue, I'm sure.
Yeah, and especially with major trauma, whether it's a car accident or somebody gets hit with a baseball bat, that's completely like a facial plastic surgeon that's going to be your person to handle that one.
And we've seen that too with fellows coming back sometimes from war who just had these horrendous injuries and lost parts of their jaw or their entire jaw. And there's a rebuilding process that has to go on with that.
Yeah, they even do bone transplants to try to provide a structure to regain the normal function. So yeah, those are all way beyond the TMJ that plagues a lot of people that kind of suffer in silence. But I would start with ice. There's a lot of things that our office can do for you, but if it's something that you've already tried really conservative things or even a bite block, I would at least encourage you come see us first before you talk to somebody about doing a surgery on that.
And when you think about this, I guess as you get older, you're going to see more people suffering from it because that wear and tear in that age. So it's not necessarily an issue with the young as much as it is people as they're growing older.
No, that's not true. Actually, I would say with the arthritis, it would be more in a true joint deterioration. That would be the older crowd. But most of the people that have this are in their 20s, 30s, 40s. So they're right in the height of, family activities, trying to build their career. They've got a million things on a million different directions, and I think that's the real cause.
I have had these moments where I get what I would call, I would refer to it as a stinger, and it feels hot, and it's a quick, sharp pain there, doesn't last long. What would that be the result of?
Well, that it could be that joint, but some inflammation with that joint because you have some significant facial nerves that go right by this. And that is, tough to say, is it there or is it your eardrum that's had some release of pressure that caused you some pain as it did that. Um, so because those nerves are so closely related and those two structures are closely related, that stinger, that burning that you're feeling that comes and goes will often be attributed to the ear or the eardrum. And it may be because the eustachian tube drains what's behind the eardrum. And sometimes if it gets kind of plugged up, you get a lot of pressure in that ear and it can come and go. But it could also be inflammation from the TMJ on the facial nerves that are passing right by it.
Are there exercises people can do to try to, if they have the pain, to try to reduce it?
They are, and the truth is, it's more of a relaxation. It's massage, it's stretching. There's some techniques I can actually show. It's called muscle energy that will help relax that. But and an exercise for chewing actually just would add to the problems because that's what you've been doing. You've been really working those muscles out.
They used to teach us as broadcasters certain facial exercises to sort of, relax your mouth before you went on the air. And I used to work with a fellow who constantly, they'd come back from a commercial break and he'd still be doing them on the air on live TV.
Awesome.
Suddenly realize he's sit there straight up in his chair and say, and else, other news tonight or whatever he would have to say. But
Right.
he frequently was caught doing those exercises.
Well, kind of like shrugging your shoulders when you have tightness in your upper back or neck. if you allow your jaw to hang open and actually just lightly move it side to side, you'll find that it does help loosen those things up. But the massage and the ice is going to help you a lot more long
Was a
term.
guy, his brother played for the New York Giants, but he played for one of our competing schools, and on the basketball court, his mouth was always open like that as
Wow.
it relaxed, and so his nickname became Flytrap. But no one called him that directly to
To
his
his
face.
face, yeah, he was big.
He was a big
That's
fellow.
awesome.
His brother was a fullback with the Giants, and he was pretty much built the same way, and no one wanted to offend him. We want to thank you for coming by today. Quickly, what's the contact information again?
Telephone number 208-933-4400. TrippFamilyMedicine.com on the web and Tripp Family Medicine on Facebook. We'd love to see you.
We'll see you again soon.
Yep, next week.
All
We'll
right.
be here.
Dr. Jonathan Tripp joining us in studio this morning. We've got a guest coming up in a few minutes. She's challenging incumbent Pete Nilsson for a seat in the State House of Representatives. That's on the way in just a few minutes following Fox News here on News Radio 1310, KLIX, and NewsRadio1310.com, and Top Story with Bill Colley.